What is this access to care you've heard about? Is it important? How to take advantage? Is there something important to know? Welcome, I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So this access to care is a strategy that has been implemented or tried to be implemented, especially the last few years, to improve health results by helping people get medical services of a high quality through affordable insurance coverage. But it is also your patient's right under the terms of your policy and under certain legal mandates. Access to care usually means three things: affordability, availability, and timeliness. Let's start with affordability. We all know healthcare is expensive and that the US spends more per capita on healthcare and medical costs than other Western countries. Just the premiums for health insurance are so prohibitive that at least 10% of the US population does not have insurance at all. And how many more are underinsured? And yes, all of these healthcare dollars do not lead to better outcomes. On the contrary, the US leads in lower life expectancy and adults with higher number of chronic conditions than anyone else in the Western world. It makes sense if more than 10% of the US population has no insurance at all. They are less likely to have a primary care physician or to seek care unless it's a true emergency, and they'll be less likely to afford that care once it's too late. And for those underinsured or with a high share of cost, they still face difficulties managing those costs, leading to a high rate of medical debt and bankruptcies. Another main reason why access to care has to be mandated, or at least firmly encouraged, is the challenge of rural areas. 60 million Americans live in a rural area where distance to a physician, to a hospital, can be a big problem. Medical equipment facilities or specialists are harder to come by, and smaller insurance networks mean less choices or availability. This also translates in very troublesome statistics. Networks of providers, meaning those who contract with your plan, are notoriously larger in cities or metropolitan areas and much smaller in rural parts of the country. And a third reason for access to care to be really pushed up front is timeliness and connection, meaning available appointments, practices that match your need and the scope of your medical concerns. Again, an in-network list of providers that is extensive enough to provide timely access to those appointments, but also convenience so that you drive less than 15 miles from your residence to find at least one competent, experienced medical provider. The staff, the practice have got to be supportive again of your specific circumstances. By this, I mean the wait time to get an appointment should be short, especially if the need is rather emergent. Is telehealth an option? What kind of expertise can this provider offer you? Do they speak the language that you speak? Are they the gender that you prefer? Does the practice offer hours of operation that match your life and your schedule? How easy of access is the location? Does it take the staff or the doctor a long time to respond to your requests for a callback, for a refill, etc.? To meet the access to care requirements within the terms of your policy or, again, per legal mandates, include many things that you, your medical providers, your insurance companies must juggle in order for you to get the medical resources and services that you need when you need them and provided by who can render them the best. But to every problem should be a solution, right? So if access to care is something mandated and if solutions have already been found, for example, free preventive care services, marketplace subsidies for insurance premiums, value-based care, which I detail in a different video, early detection lead to better outcomes and lower costs. So let's see how to take advantage. First, if you are uninsured, do consider getting onto the marketplace website, healthcare.gov, and see how or if you can qualify. It is easy. Put in your zip code, some information as to the size of your household and yearly income, and it will give you a list of plans that are available in your area and at what cost. Now, there's a big plus with using the marketplace is subsidies. First, those plans are going to be cheaper for the equivalent on the open market if you were to buy it through an insurance agent. But also, depending on your income as well as the price of a policy you choose, you well could be eligible for subsidies that the government will extend to you to help you pay those premiums. Some states, like California, have their own exchange. But if your state does not, healthcare.gov can help you. If you recently lost your insurance because you lost your job, you retired, or quit your job recently, or even are in between, don't forget to consider COBRA. It is your right to continue receiving the same insurance coverage your employer had been provided to you until you no longer worked for them. Even though you would be responsible for the payment of premiums, you and your dependents could continue being covered at the same level as you were before. Your employer, HR, should give you a written notice at the time employment stops for whatever reason, and an application to sign up for COBRA extension of coverage. Do watch my special video on COBRA as well. Once or if you have insurance, well, use it. There are so many different services that are free to you, and those include a range of preventive care services for you, your spouse, your children. Their range may surprise you. Your insurance will offer telehealth services, a list of network providers, and online resources for you to consult or use. Don't forget, there's a nursing line open 24/7 as well as a mental health crisis line available to you at all times. If you cannot reach your doctor for a refill or have a question about a new prescription, do call the nursing line, for example. Access to care can mean so many different things than just a face-to-face with a provider or a visit to a hospital. But if you do need one of those, make sure you try and find an in-network provider. You can call your insurance, consult your online portal, and save the most money. Now, last, I would also check what the law in your state and the terms of your policy indicate. Access to care means a certain number of days or hours. Your insurance companies must be able to provide either emergency or urgent care or routine primary care to its members. Some of it could be within 10 business days when you first request it, or it could be immediate access 24/7 or 48 hours, and so on. The terms of your policy will detail requirements imposed on your insurance company. I would also suggest visiting your Department of Insurance website in your state. Why? Because some states like California have very strict requirements that they place on every insurance company doing business in the state. The most important thing that you may need to know about access to care is that because of these requirements per the terms of policy or legal mandates, if your insurance or your network cannot meet the requirements in a timely manner, or because there is no appropriate, trained, available, experienced provider, and you must go out of network to get that medical service, your insurance can and should be forced to cover out-of-network claims at the higher in-network rate. And that will save you tons of money. Yes, you must document. For example, the provider list on your online portal was not up to date. The provider does not accept new patients, or you have a rare condition, a rare disease, but no super specialist is available on the network. If the only available provider is too far, too inconvenient, or has limited hours of operation, only offers telehealth when you would like a one-on-one face-to-face appointment, or if waiting for that appointment could take weeks, then your insurance must provide you with the opportunity to request an authorization to get services at the in-network rate for out-of-network services. And if you had to already get those services, then remember, you have a right to appeal. That means to request a review of how a claim was processed based on specific circumstances. So argue precisely and clearly, and don't forget to include supportive documentation. A positive response in the form of a special authorization or reprocessing of your claim at a higher level should be approved. I so thank you for watching. I will note in the description below other videos you might find interesting and that relate to this topic. So thank you for subscribing, for commenting, for liking. It helps my little channel grow a little bit at a time to reach out to more patients like you. So thank you.